A patient had came in with a condition known as dysautonomia or vasovagal syncope and POTS. Because we've seen some results with her and what she's experienced with headaches, no more headaches and migraines, vertigo, dizziness, vision disturbances, a lot of those have honestly disappeared. Dr. Chad Janes. My office is Janes Spinal Care, and I want to share a story with you of one of my patients named Taylor.
So as far back as I could remember, I always had fainting episodes. When I was in second grade, I would go to recess and I would pass out, and I became known as the girl that passed out at recess. And so for a long time, they told me it was because I didn't eat enough or I didn't drink enough. I saw a lot of doctors and no one ever could really give me any answers. And so from third grade, I would say up until high school, that's just kind of how my life was. So I had to make sure I was hydrated, that I ate well, because any sort of outliers that were out of the norm would send me into a fainting episode.
Taylor always had migraines. Even going to work, sometimes she would have to pull off to the side of the road and actually kind of regain herself, or she had bad vertigo, or even if she thought she was going to pass out, she would pull over. Limited life.
About 26, 27 years old was the first episode that I can remember. And my husband and I were actually on vacation, and I remember waking up and it felt like my heart was stopping, which essentially it was. I was trying to just get up, get moving, try and get a grip on things. And somewhere in between the bed and the bathroom at this beach house, I just lost consciousness. And then 2 years later, maybe a year and a half later, I had another episode at home, and then they just kept getting more common, more frequent. The cardiologist told me, I was young, I was healthy, especially in the profession that I was in, being a CrossFit coach, he didn't really have any concerns. So I had to wear a heart monitor for 30 days, and they didn't find anything on the monitor. I had occasional PVCs, or premature ventricular contractions. He said it was nothing to worry about. If they became bothersome, then I could go back and see him in the future. And then one night I had a really terrible episode, and enough was enough. We decided to see a neurologist and a neurosurgeon, and no one could just give me any answers for what was going on. I ended up back at the cardiologist office. He said, there's really one more test that we can do. It's a tilt table test. I don't think anything is going to come of it, but it's just kind of check all the boxes and see where it goes from there. So during that tilt table test is when things really snowballed, got out of control. My heart stopped for 20 seconds. They almost had to call in the rapid response team. And at 2 o'clock that afternoon, I had a pacemaker. I ended up working at a gym with a DPT, or doctor of physical therapy, who said that she really thought that there was someone out there that could help me. And so I followed her lead, and that's how I met Dr. Chad.
The moment that you said, I feel like there's a disconnect between my brain and my body, and I think it's in my neck. And that is exactly what we do, is find that disconnect within that upper neck, especially in that brainstem, those top two bones in the neck that hold up that skull the way it's supposed to. So dysautonomia is that dysfunction in that autonomic nervous system. So technically, every single person that comes into my office, we can diagnose them with some form of dysautonomia, because every single person that we see and I check for an upper neck misalignment is because there is a dysfunction in that autonomic nervous system because of that upper neck misalignment.
So a really defining moment for me when I first started seeing you, that I knew that things were changing in a way that they hadn't before, it was one of my first adjustments. So I started seeing you in September of last year, and we went on a camping trip about the middle of October. I completely forgot for that week that I had a pacemaker, that I had vertigo, that I had migraines, and it was the first time in a very long time that I was actually able to just be present and not be a victim to all of these symptoms that I had lived with for so long.
So because of your positive results that we've seen with Upper Cervical Chiropractic care, that's what kind of sparked this journey to get your story out there to anyone that's suffering from any one of these conditions, the headaches, the migraines, the vertigo, dysautonomia, vasovagal, syncope, or POTS. And if one person listens and tries it, or even just sits down with an upper cervical chiropractor to see if it's a right fit for them, and then they get help, and then that person shares their story and that person shares their story, then eventually, hopefully, our goal is to just help people get out of this endless suffering, because it is not needed.
I don't know how you can even begin to thank somebody who has given you your life back. And so I thank you for that. Truly, I do. And for a long time, I tried to find the silver lining in everything that had happened, because, you know, you think things like this will never happen to you, and then they do, and you try to wrap your brain around it. But I think if I am able to have my story heard by just one person, and that person ends up seeking chiropractic care or upper cervical chiropractic care and is able to change their life or get their life back, then I know essentially that is the silver lining in all of this for me.
So one of the reasons why we were able to get results with Taylor, with her specific case, where it seems like no one else could get results or give her answers, was because of what we do as chiropractors. Especially what we do as upper cervical chiropractors. And what we deal with is the top two bones in the neck. And when that head is shifted off to one side, or to the other side, or to the one side, due to an upper cervical misalignment, basically those bones are misaligned from a accident or injury that has happened at some point in their life, that kind of tears loose those little connective tissues that hold those bones of the spine together. When that head weight shifts to one side or the other, it actually puts pressure on that brainstem. In Taylor's case, what also happens is that when that upper neck, that top bone, misaligns, it actually can also interfere with a nerve called the vagus nerve, which is on the outside. And when that happens, it can create a lot of her different conditions or symptoms. So as upper cervical chiropractors, we take specific films, we utilize technology. One of the technologies that we use in our office is infrared computerized thermography. This detects when that nervous system is in a state of dysfunction, and be able to make more of a specific or accurate correction to that. And that's what allows us to see the results, where honestly, most other doctors kind of miss it. If somebody's interested about starting upper cervical chiropractic care, the best place to find me is either on my website at janesspinalcare.com or on Facebook, Janes Spinal Care.